is the most wonderful time of the year, and we're celebrating right here on Soda City Living with our 10 Days of Christmas special. For 10 days, we'll be highlighting unique gift ideas, activities, and more that you can do with your family. Check it out.
My name is Elizabeth Tomali-One, and I'm a nurse practitioner. This is what I would call my treatment room, where I come in and do the in-mode for the MORPHEUS treatments for the face, neck, for urinary incontinence. I do everything right here and use my machine, and I have my props and everything right here. So medical-wise, I treat the whole patient. I do anywhere from cardiology to the diabetes, the lipids, heart disease, thyroid, women's health, and men's health, everything, just all wellness for the women. So I have a lot of women that come to me after they've had babies or getting older, and they notice they have a lot of urinary urge incontinence with working out, walking, and so they come in and see me, and I do a consultation, and then I use the in-mode machine, and I help with pelvic floor strengthening, and they get really good results. They usually do about 6 treatments, and I've had wonderful results. Women, they can now walk without having leakage, and I have a lot of women who work out and they can jump rope now, and they're just loving it without actually having invasive surgery. So it is 6 treatments every other week, and then I also have another treatment that's 3 treatments every other week. So what this machine does, it's got radio frequent. The radio frequent helps with the muscle contracting, and so it sits there and for their treatment for about 30 minutes. It just sits there, and I go up and down on the machine. So this one is for tightening, and this one's for the pelvic floor strengthening. So this one's the one that is 6 treatments every other week, and for the tightening, it's 3 treatments every other week. And you can do both of them. Usually, just for like the primary care, they'll come in and I do labs on them, a full panel, and I get them started on the right medication for diabetes or for their cholesterol, and I just guide them through and help them live a better lifestyle, and get them on the right medication if they need medication. If they're on the wrong medication, we go through their medications very in depth to make sure it's right for them. I prescribe cholesterol medicine, high blood pressure medicine, diabetes medicine, HRT for women and HRT for men. It's just lab work. I will order some labs for hormone labs, and they just go to a lab like LabCorp, and I'll get the test results back in 24 hours, and they come in, and then we go over it in depth. And I decide what plan I want to do with their hormone levels, what medication and they need. They will come in and see Dr. Connor first, and someone will see a massage, and then they see me last, and I'll help them with their medications or anything that they need. Also, a lot of patients, I have to do the home sleep study instead of the in-lab study, so they don't have to go spend the night. And so the home study has been great for my patients, because they'll come see me, and I will ask them a certain amount of questions, and then I have the home sleep studies in the house, and I give it to them then, and they take it home, wear it in their own bed, and then they bring the study back to me, and I get results back within 24 hours. I get a doctor to read it, and then I set them up on their CPAP treatment. So it's just a little device about this big, and they just put it around their belt. It's a belt, and then they just put a pulse ox on their finger and a little oxygen tube, and they go to sleep. And they hit record right here. It's a little machine, they hit record, and they fall asleep when they go to bed, and then when they get up, they just hit the button off, and they just bring it back into me, and I hook it up and get the data, and I send it over to a physician. So this is the in-mode MORPHEUS 8 right here. And so what I do usually is the patient comes in, and I do a skin assessment to see where they're needed for the fine lines and wrinkles. And so what this is radio frequency, and it penetrates past the anticoagulation area of the skin and helps rebuild cellular turnover and helps with elasticity and tightening. So that's what I would do first. And then I set it up over here, I would hit the MORPHEUS. And then there's several different levels, and I would know what to do for the patient, you have to do. And then I just start their treatment. So what I do before their treatment, I will numb them with some lidocaine for an hour, 45 minutes to an hour before. And then that usually helps with everything because it's just a little discomfort. For 48 hours, you do not need to use any retinoids or have any makeup on. It just needs to be dry and use just gentle washing and facial products. First, I'll ask the patient, like, what brings them to see me? What are their most concerns? Is it the facial tightening, the neck, their eyes? I see what they really want to get out of the service first, and then I talk to them about what I can do to help them and what I see is best for them. This is a bi-weekly too. It's 3 treatments bi-weekly, but usually it takes about 6 treatments to really see results. And another thing is, you're not going to see results instantly. It takes about 30 to 90 days. So I like to tell my patients that so they don't get their hopes up, like it's not an instant gratification. So it will feel like after I'm finished with the treatment, it looks like they have a mild sunburn. And so you would put things on like Aquaphor, like a mild lotion, just to help with the dryness for the next 48 hours. It just feels like a light sunburn. When you're preparing for your treatment, before you come in that day, you don't need to put any makeup on or lotions or anything, just a bare face. That's really everything that you need to prepare for that day off. I've had several patients, I've done the cellulite area, and after 3 treatments, they're very happy. There's been 3 treatments, and I've also had several women that I've done their turkey neck, and they're extremely happy too. I use the MORPHEUS 8 as well, and then I would numb usually just their neck and their airline, and we just do this treatment area. And this tightens it, and it helps with new cell growth as well. They are slimmer, and they're just loving the tightness and everything, and they're loving that they didn't have to do like a facelift or something invasive to help with that. Every 6 months, you should get 1 treatment, or at least every year, 1 treatment.
We'll be right back with more of our 10 Days of Christmas special.